Good afternoon everyone. Do you know that if a pregnant woman has some dental issues or gum related issues, then the chances of giving birth to a premature baby becomes very high? Hi, I'm Dr. Bhattacharya. I'm a pediatric dentist from Mumbai, and today in this video I'll be telling you some tips or tricks how to maintain oral hygiene for pregnant women. First and foremost, what I like to tell you is that before the pregnancy starts, some women might have some dental related issues, but they don't show any signs or symptoms of any pain or any discomfort related to the dental issues. But the moment they become pregnant, these signs and symptoms related to dental issues start to pop out, and they have some form of discomfort or pain related to dental treatment. Now, to avoid all these scenarios, I'll be telling you certain aspects, certain things which you can take into consideration before you become pregnant or during the pregnancy time. First and foremost, what I would suggest is, the thing is, you need to first and foremost meet the dentist every 3 to 6 months on a regular basis, so that you don't have any dental related issues which can aggravate during your pregnancy time. Second thing is, if you're planning to become pregnant, I would suggest first and foremost sort out all your dental related issues which requires fillings, root canals or extractions before you get pregnant, so that you can avoid all these painful dental related procedures during your pregnancy time. Thirdly, the most important part is your diet and sunlight exposure. Now, as you're aware of, mother is not only harnessing the immunity for herself but also the baby which is there in the womb. So obviously proper diet is very important for pregnant women, and proper sunlight exposure for proper vitamin D so that they don't have vitamin D deficiency. Now, in these kind of cases, obviously the mother's oral hygiene has to be at the topmost priority. Fourth thing is, if at all you need some form of dental treatment, then yes, less extensive therapies like teeth cleaning or teeth scaling, fillings can be done very safely during the pregnancy time. But yes, if suppose the pregnant mother requires some form of extensive treatment like root canal therapies or extraction, then obviously we will require some form of consent or some kind of permission to go ahead for the dental treatment to carry out certain extensive therapy. Hence, to avoid such kind of extensive therapies, I would recommend you to keep visiting the dentist or following up every 3 to 6 months pre-pregnancy or during the pregnancy time to avoiding such kind of extensive therapies during your pregnancy time. Fourth thing is, as you're aware of, the child's teeth develops at the 3rd month of pregnant time. That means when the child is in the mother's womb, the teeth of the child is developing. And if suppose the parents or the mother's dental problems are there, or she is under medication, then that will also affect in the child's oral cavity. Hence, to prevent your child from having tooth decay at an early stage, mothers who are pregnant needs to also have a good oral hygiene and a good gum, healthy gums. Hence, you need to maintain it. Lastly, there is something called as pregnancy tumor, or in a dental term we call it pyogenic granuloma. That is a very common effect that is seen in pregnant women. This basically, the gums are swollen and they bleed profusely even at a slightest touch. In this case also, proper oral hygiene maintenance and teeth scaling is advisable, and proper mouthwash rinsing can help regress this condition. So if you know, if you are pregnant, or if you are going to be pregnant, or if you know someone who is pregnant, please do come in contact with a dentist or a pediatric dentist and get to know how you can maintain your oral hygiene during your pregnancy stage, so that later on your child also develops a good oral health. So if you have any doubts, please do let me know in the comment section or join me in the link.